BVD is a fairly broad term that we can then subcategorize into different parts. I like to break it into sort of three type groups of symptoms. We've got what we call eye-related symptoms, performance symptoms, and spatial organization symptoms. And so, if we're talking and we're not optometrists and we want to sort of talk about the kind of symptoms that might make us go, that kind of sounds like an eye problem. They're your eye-related symptoms. So things might be going blurry, the print might be moving around, I might get some sore eyes, some tired eyes, and even sometimes people might make the connection that their headaches seem to be triggered by doing near work. So a lot of those eye-related symptoms relate to doing concentrated work, particularly near, reading, screen, devices, those sorts of things. Certainly some eye-related symptoms could happen from BVD when driving and doing other things, but the key part is it's when you're trying to concentrate. Your performance-related symptoms are those kind of things where, again, if we use near work as an example, you might have trouble concentrating. You're finding that you get to the bottom of the page and have to read things again, or you kind of feel like you've got to force yourself to focus. You might find that you're kind of starting to avoid reading, just feeling tired at the end of the day. And so they're the kind of symptoms that you could blame on lots of other things. And that's the nature of BVD. Sometimes it goes unnoticed because you can't sort of look at someone and go, oh, you've got BVD. And we kind of call it a hidden vision problem a lot of the time. And if I'm talking to parents, then, kids will sometimes divide into either more eye-related symptoms category or more performance-related symptoms. And the reasoning around that is that the kids who kind of push on and keep engaged in the near work and the devices are more likely to get the direct eye strain and blur because they keep pushing and pushing until you hit that point. Whereas performance-related symptoms are almost like that subconscious trying to back out of the work or escape from it. And so you don't push yourself to the point where you get physically uncomfortable in your visual system, you kind of tune out instead. And then if we get to the third group, you've got your spatial organization symptoms. So this starts to become beyond just what's happening with near work. So you might have trouble perceiving or judging depth. And that's going to result in, adults might complain that they don't judge parking the car very well. They don't like busy roads because they can't be completely sure where the other cars are. They might trip upstairs, bump into people a lot, bump into doorways is a common one. And you can also get people who might get some dizziness or vertigo. And that's because what I like to talk to people about is our sort of spatial, our sort of triangle of understanding where we are in space is the coordination of our binocular vision. So that's our whole visual field, two eyes working together to create one stable image of the world out there. And that needs to communicate with your balance systems here. And it also needs to coordinate with your brain's understanding of where your head is relative to your trunk and the rest of your body. So, I mean, it's your body awareness from feet up, but effectively we like to talk a lot about the sort of head positioning because we use our head and our eyes together as part of looking. And if you have any difficulties matching the information between those systems, then you get this vertigo or dizziness response. And the way I like to explain it to my patients, it's almost your brain's way of saying, will you stop? Because I'm not sure of the world out there. And if I make you dizzy or get vertigo, then you kind of start to freeze your movement so that your brain can kind of protect itself. And so you can get that wide sort of scale of symptoms anywhere from sort of, eye strain right through to, for some people, debilitating dizziness and vertigo in extreme cases.
Let's talk about headaches for a second, because people experience all different types of headaches. I've sometimes, not so much these days, but I used to get headaches at the sort of the back of the head, but I think that was more of a posture thing, and maybe like not sitting properly. But with people who have binocular vision dysfunction, does that headache sort of manifest itself, in a particular way?
Yeah, the classic eye-related headaches are typically frontal, along the front, behind the eyes can be the classic one. You're right, the back of the head headaches are often from neck and posture. They can sometimes refer through to an eye pain. And so I'll often kind of get into the nitty-gritty of, what does the eye pain feel like? And that's where I'll often make a referral to a physiotherapist or some other physical therapist, osteopath, chiropractors, depends on what the patient's preferred kind of modality is. And because they're often referred pain. But you can indirectly get some neck tightness and neck pain from a focusing problem. There's been plenty of studies to show that when you force your eyes to work, your neck muscles tighten. So over time, this back of head headache can be a combination of being frozen in your posture doing near work, but also because you're forcing your eyes to work as well. But the classic one for kids, as an example, is the headaches that start during school or after school, and they're typically the head. And often they won't complain about it until you ask. I like to say to my parents is that I keep the questions open. I ask open questions. The kids can't answer yes or no, so I can get an honest appraisal of what they're doing. And so I ask, how often do you get headaches? And they go, oh, a lot. Show me where. And they point to their head and what part of the day. And so you can see them ticking the boxes for the classic asthenopic eye strain or binocular visual dysfunction related headache.